Welcome back, everyone, to my channel, Case Manage, Concussed, and Post-Concussion Syndrome. Today, I'm going to cover a topic. We're going to talk about mild traumatic brain injury and the fatigue factor. And this is a how-to walkthrough guide. I hope everyone finds this helpful. Please feel free to leave any comments, suggestions, questions, anything, any shouts out there. I'd be more than happy to hear from you. Mild traumatic brain injury and the fatigue factor. I can speak amongst most out there in this community that fatigue is one of the most debilitating disabilities a mild traumatic brain injury patient will have to live with, and is the second most commonly identified symptom amongst patients in our community, and is the most overlooked by medical professionals. MTBI and the fatigue factor. Mental fatigue is a frequent trigger for physical fatigue. What does that mean? When the fatigue begins to escalate and goes up, often the post-traumatic headaches will flare up. Memory problems will become worse. But segue to the physical pain, when the fatigue goes up, the physical pain goes up. It's a matter of finding that balance, and that could be always our biggest challenge. Mental fatigue. What are some examples of mental fatigue? For one, socially interacting in a large group, such as a birthday party or attempting to shop at a shopping mall, will just wear one down completely. Balancing a checkbook. This involves tasks that involve our concentration. Reading, writing are examples of that as well. Sensitivity to stress. The more you stress, the more anxious you become. Mental fatigue will escalate. Sensitivity to light, sensitivity to sound, photophobia or phonophobia, which are quite common amongst the many in our community. Mild traumatic brain injury and the fatigue factor. There are many triggers to mental fatigue, and I have pictured here what can look like to most of us as the black hole of mental fatigue, and where that spiral will just take you down that path. Triggers for mental fatigue. Headaches following overexertion. It's a very common problem. If we end up overexerting ourselves, headaches is a sure sign. Sleep problems, concentration difficulties, slowness of thinking, irritability, an unusually drain of rapid energy. It's like you're completely gassed out. You want to put the pedal to exert more energy, and you can't. You have to have an innate desire to lie down, and when that doesn't happen, this will trigger many of the symptoms here. The physical pain, the slowness of thinking, memory, recall will all become worse. And this circle of what I call the black hole of mental fatigue is a good indication for us all in the community to be sensitive to. And for treating providers out there who are listening to my channel, I would strongly suggest to please give consideration to this picture when educating and treating the brain injured patient. Thank you. Brain fog. Brain fog, this picture says 1,000 words. This here is very much what we feel like with brain fog, is when your energy is so low, everything appears to be grainy and looks like one big blur, like you're walking in the clouds, like this man here is in this picture. Prime example. MTBI and the fatigue factor. When those treating providers out there are evaluating their patients, you should be looking and evaluating your patient and really giving consideration to those symptoms. And for patients and caregivers out there, this is one I'd want you to give close attention to when communicating your symptoms to your physician. Lack of sleep, that's a big one. Nutritional deficiencies can segue and make mental fatigue worse. Hormone imbalance, especially regarding dopamine, serotonin, cortisol, which all are impacted with a brain injury. Poor diet, too much sugar, caffeine, and refined carbs can also lead to mental fatigue and be a huge factor that could increase brain fog. MTBI and fatigue. How to walk through. The first thing I would strongly give a suggestion to is utilizing a PACE method. A PACE method was something that was my physician educated myself upon, and I have outlined in my mild traumatic brain injury playbook to help patients, caregivers, and also treating physicians out there. It's available in paperback and ebook. Secondly, when we're looking at a how-to walkthrough guide, let's try to avoid processed sugar and artificial sweetener. That is extremely important. And for those treating providers out there, there are a number of labs that you should give a consideration to. I'm not a doctor, so I'm definitely not going to say you have to do this, you have to do that. I'm using the words consideration from a patient's perspective and also from a case manager's perspective. As I served as a case manager for a number of years, post-acute and subacute care prior to my injury. The first lab I would give consideration to is TSH. Those are hormones that are regulated in what they call the pituitary gland. This includes T3 and T4 in the bloodstream. This test is usually the first lab physicians should consider, definitely to detect a thyroid deficiency. A thyroid deficiency can impact appetite, mood, and sleep. Secondly, T4 free. T4 free is one of the two hormones, as I indicated, that the thyroid gland actually secretes, and is a protein that floats in our bloodstream. The thyroid gland is a butterfly-shaped gland, and this is just to give the patients and caregivers an idea, is a butterfly-shaped gland that is found in our neck, and this controls our energy use. And T4 free also detects problems and deficiencies with our pituitary gland that regulate our ability to sleep. These can be impacted upon when the brain is injured. The next lab I would strongly suggest and recommend to those treating for physicians out there is cortisol levels. This is a steroid hormone that is produced in the adrenal gland, and impaired adrenal gland can be an indicator of mild traumatic brain injury damage to the circulatory system or bloodstream, stress response, blood pressure, and the immune system. Finally, A1C, glycated hemoglobin, is a test of blood sugar over the last, usually gives an indicator between over the last 2 to 3 months. High blood sugar or hyperglycemia demonstrates a stress response that may indicate a poor income for the brain injured. Regulating glycemic levels during the initial course of injury has improved the overall neurological function. So providers, be cognizant of this fact that when you are treating the concussed patient, an A1C is vital in really looking at the course of if there needs to be treatment with the blood sugars, because this could have a long-term effect on the patient, and particularly with the neurological function. High glucose, as you doctors know, but for the patients out there, is a regulation of the cell's life cycle and oxidative stress. And this is what occurs during a brain injury. So very, very important for you doctors who are reviewing and looking at my materials to give consideration to this and the many labs that I have shown throughout the course of my presentation. MTBI and fatigue factor and a how-to walkthrough guide. And I have discussed a little bit previously in my video about foods. Now, there's certain foods that can help, and those are called anti-inflammatory foods. And I'm not going to go into great detail with this, but I have provided a list and a guidance for patients and caregivers, as well as physicians to go over with their patients. Orally fish, ginger, turmeric, all invaluable to brain health, along with berries, and something that I wasn't quite aware of is chili peppers and olive oil. So please take a look, and there is a list also of foods that need to be avoided. So hopefully you find this helpful. Although this should be completed on every doctor's visit, it's very important for patients and caregivers I advise to just all the medications you're taking, including your supplements, put them in a big, I'm sure you have a system where they're lined up at home for administration. Place those bottles in a bag, all of it, supplements, medications, and bring them into your doctor. So those can be reviewed. And this is very important, especially to discuss with your doctor if there is a way to schedule medications times to minimize your sleep disturbances, meaning medications that have a sedative, a drowsy effect on us to be more administered towards the late afternoon and evenings versus the early morning hours. Another helpful tip is to see if there's a way to, as I was indicating, switch those medications around so they have less of an impact on our sleep. How to walk through guide. Naps. Do not be ashamed if you have to take a nap during the day. Accept the fact, if you're brain injured like myself, more than likely you're going to need one. A nap may help energize the day and give you a little ability to improve your sleep at night. What you don't want to do is, if you do not have a pace method in place, to push yourself over where you're so mentally fatigued out that you're blown that you have to just immediately go down at a drop, or if you can't, and then the pain just increases, the fatigue increases, and you end up down that spiral. Naps are okay. And for your doctor and for the doctors out there, please give your patient permission to take those naps to hopefully get that energy level that they can get back, if they can, to complete their day. And this may also improve their sleep at night. MTBI and how to walk through. One useful tip to minimize the effects from fatigue by concentrating on more intense tasks is to do them during your most energetic time of the day. For most of us, this is typically in the mornings. Acceptance. Acceptance is a challenger for us all in the MTBI or TBI community, as it's difficult to admit that it takes much longer to complete tasks as it did prior without becoming overexhausted. It is all about the pace and taper, very much like a skilled runner in a marathon. An astute runner recognizes that moving at a faster pace that they can do will ultimately lead to lower performing results, as they will have little to no energy to finish the race. For the patients and caregivers out there in the community, here is just a quick list of some considerations to give some thought to. Do not hesitate to ask for support from family and friends when managing tasks. That's one. 2, find a way to minimize the complexity of everyday tasks. One great example is automated billing when paying your bills versus doing it manually or using a calculator. Exercise, number 3, not only strengthens your muscles, but improves circulation and increases your metabolism. The many benefits of exercise not only help with preventing depression and reducing weight gain, but processing nutrients more quickly in order to help the body to heal. And I'm going to just throw this out as a blurb. Please consult your physician before you start an exercise program. That is extremely important. And for the treating providers out there that are not in the know, any form of physical exercise, as tolerated, is only going to help the brain injured or traumatically brain injured patient at the end of the day. Do not discourage it, but order it as the patient can tolerate. Finally, limit or try to drink little alcohol. Alcohol does a number of things. It impairs cognitive function, and disrupts our sleep cycle. Two things that are dead poison to the mild traumatic brain injured patient at the end of the day. Unfortunately, the body does not rest nearly as deeply when it's busy trying to process alcohol. If you plan to drink it all, select a scheduled time several hours before bed. MTBI and fatigue and how to walk through. I want to thank everybody very much today from that have tuned in to my channel. As I said before, if you have any questions, comments, please feel free to drop me a line. Always open to subscribers. Thank you.